This presentation, titled "What's in the Way? Examining Barriers to Healthcare in Rural Settings," is an unoriginal research review by Courteney Boyle, Stephanie Bremer, and Maria McMahon through the Carroll College Nursing Department. So we were inspired to research this topic because we're from a rural area. We are in the rural community a lot and working with people who are overcoming these barriers, and we're seeing how healthcare professionals are approaching it. And we just wanted to expand our understanding of healthcare to have a more holistic view and how to better help our patients. So we wanted to compare our understanding to an urban perspective. And so our PICO question is, in patients receiving healthcare, how does rural living compared to urban living affect barriers to care? And so we started off our research topic by first defining the terms rural and urban. And this is based off of population density according to the United States Census Bureau. And even though some of our articles were not national and didn't apply to those definitions, there was just a lot of variability. And to pinpoint our population, we just chose to stick to the United States definition. And so following that, we identified specific health risks for each location. So for example, in rural areas, they have a higher risk for unintentional injuries, and then also conditions like heart disease or chronic lower respiratory disease and stroke. And then in urban areas, they are at a higher risk for infectious diseases and non-communicable diseases, and then also violence and depression. And then after that, we focused on the specific urban barriers, and that was just to give us a general idea of the differences between the two. So in an urban population, they struggle with a couple of their barriers to care include higher population density, varying financial situation, cost of care, and then also the lack of research, which became very evident throughout our research process. And then in the rural areas, they have issues with longer commute times, decreased financial stability, the lack of education, and the perception of self. As previously stated, this is a literature review. We did not do any of our own original research for this project. So our process of researching included, we brainstormed ideas and eventually decided that we were going to investigate these rural and urban populations. And so utilizing the Carroll College Library database, as well as CINAHL and PubMed, which are two medical databases, we searched for articles. Some of the criteria that we selected to fulfill our research needs included looking at studies that both were compared a rural and an urban population, as well as studies that occurred within the last 5 years. We also made sure to not use any level 1 evidences that included systematic reviews, because we wanted to basically create our own systematic review. After doing our research, we were able to compile 6 articles that met the criteria that we had outlined. Each one of these articles came from a different geographic location, except for we had 2 within the US and 1 specifically took place in California. Other countries that our studies were performed in included Canada, Pakistan, China, and Saudi Arabia. So some of the common barriers that were identified in these studies included that rural populations tended to not know who their provider was. They couldn't identify a specific person, but they could identify a specific office or maybe an urgent care clinic where they received their care. Rural residents were also more likely to have increased travel times from a usual source of care and more difficulty communicating with their provider, which is something that is pretty well known within the medical community and was just reinforced in our research. Additionally, in Pakistan specifically, their barriers to care included financial limitations, perceived wellness. They thought that they were doing okay when maybe they really weren't doing quite okay from a health standpoint. And they also had restrictions from family members to seek care. Additionally, in our research that was performed in China, there was a perceived worthiness of care difference between the urban and rural populations. Rural populations tended to view themselves as kind of unworthy of care and that they were just not entitled to medical care from the government, whereas urban populations thought of themselves as citizens and really thought that the government should give them medical care and that they should provide that for them. Additionally, in Saudi Arabia, we kind of saw how maybe some of the health barriers that we see in urban populations, such as increased education, increased income, and better facilities, was the opposite in Saudi Arabia. There, the rural populations had increased education rates, increased income, and experienced better facilities. So overall, we were able to identify some specific barriers, but there really weren't enough to be very definitive.
Overall, research was inconclusive due to most of the articles focusing on rural barriers rather than urban and rural barriers. More research is therefore needed to address these urban barriers that this population faces. This research that would need to be conducted further would need to be a qualitative study. Ideally, we hope this will provide insight on various urban barriers that this population may face. Nurses can utilize the research available to improve information. For example, urban barriers were addressed on the World Health Organization, or WHO, however, were not addressed on the Centers for Disease Control, or CDC. It is important for nurses to continue to perform comprehensive assessments that focus on addressing individual barriers to healthcare. Identifying these areas where we as nurses can help identify different resources to overcome some barriers such as transportation or finances. It is very important that we as nurses advocate for each of our patients in order to provide the best quality of care to our patients.
We'd like to take the time to thank Professor Burkholder and Professor Banta for taking the time and all their dedication to helping us through this research process, and we appreciate all their hard work.
Thank you for watching our presentation. Have a good day.